welcome to Physical Therapy Board Exam Review, MSK. Hi guys, so this is my first formal review for NPTE or NPTAE, or for the students who wants to have a basic fundamentals of musculoskeletal anatomy. So we'll start with brachial plexus. So brachial plexus are composed of course, start with the roots, apophyseal roots, the trunks, the cords, branches, then arms, forearm, and hand. Okay. For the the brachial plexus, there is a C5, C6, C7, C8, and T1. Okay. So start with a C5. For C5, before it goes to the trunk, there is a nerve here, which is known as dorsal scapular nerve, right? So the nerve supply of the rhomboids, right? Dorsal scapular nerve. Before then, C5 for C5, C5 and C6 will combine, C7 and C8 and T1 will combine, okay? C5 and C6 will form upper trunk, C7 middle trunk, and C8 T1, this is a lower trunk. So for the upper trunk, there were like two nerves there, not muscles, two nerves there for the upper trunk, which is known as a nerve to subclavius, and the other one is the suprascapular nerve. Okay, so there's a subclavius and suprascapular nerve. Now C5, this is I forgot, C5, C6, and C7, there is a long nerve here. When they say long, pretty long, and it's known as the long thoracic nerve, which supplies what? The serratus anterior, remember that, okay? So now we'll go upper trunk, middle trunk, and lower trunk. Now sa upper trunk, it will divide it into anterior and posterior, middle trunk, anterior and posterior, and lower trunk, anterior and posterior. On the anterior part of the upper trunk and middle trunk will form lateral cord. All the posterior will form posterior cord, and the last one, this one, for the lower trunk will form what? Medial cord. So I want to point out that we'll start with this one first. So lateral cord and median cord will combine to form median nerve. And of course, median nerve, there is also palmar interosseous nerve. Okay, now for the lateral cord, of course, the most common there, they branch out to form musculocutaneous nerve. For the lateral cord, musculocutaneous nerve. And what else? Musculocutaneous nerve, and what else? The word lateral pectoral nerve. And for the posterior cord, it's thematic. Posterior cord will go straight to form radial nerve. Posterior cord, radial nerve. Then the median cord here will form the ulnar nerve. Okay, so ulnar nerve branches to deep palmar branch of ulnar nerve, right? Now, it's interesting here in posterior cord, there is three nerves here: upper subscapular, thoracodorsal, and lower subscapular. So in the Philippines, we have this mnemonic UST de La Salle. So upper subscapular, thoracodorsal, and lower subscapular. Okay. So here is our brachial plexus. See. Now, if there is a brachial plexus, then there is a lumbosacral plexus. So what are the lumbosacral plexus? So we'll start with L2, L3, L4, L5, S1, S2, S3. Okay. So L2 and L3, there is the branches of psoas major. Okay. So actually L2, L3 will combine to form lateral femoral cutaneous nerve. Okay. So L2, so L2, L3, L4, 2, 3, L4 will form obturator nerve, and another L2, L3, and L4 will form femoral nerve. So always remember, L2, L3 will form lateral femoral cutaneous nerve. L2, L3, L4 will form obturator nerve. L2, L3, L4 will form also femoral nerve. So what else here? So L4, so this is the biggest one. So L4, what is the biggest nerve or the largest nerve? Is the sciatic nerve. So it forms L4, L5, S1, S2, S3 will form what? The sciatic nerve. So L4, L5, S1, S2, S3 will form sciatic nerve. Okay, so sciatic nerve, there were around sciatic nerve, they will be divided into tibial portion around the thigh area, tibial portion, and the common peroneal portion. So the tibial portion of sciatic nerve, of course, the tibial nerve will go the tibial nerve, right? Tibial nerve. Then it will branches to median and lateral plantar nerve. Plantar nerve. Plantar nerve. So for the common peroneal nerve, it will be branches to superficial peroneal, and deep peroneal nerve. Okay, so we're done with the sciatic, okay, which is L4, L5, S1, S2, S3. Now this L4, always remember L4, L5, S1 will form L4, L5, S1 will form two nerves again. The nerve 2 quadratus femoris and what? And the superior gluteal nerve. So L4, L5, S1, nerve 2 quadratus femoris, and the superior gluteal nerve. Now L5, S1, S2, if there is a superior, there is an inferior gluteal nerve. So L5, S1, S2 is inferior gluteal nerve, and so L5, S1, S2 again, inferior gluteal nerve, and nerve 2 obturator internus. Okay, now there is in S1, S2, there is one nerve in S1, S2, which is called the branches of the piriformis. So, okay, so here are the lumbar plexus. So in review, lumbar plexus or lumbosacral plexus composed of L2, L3, L4, L5, S1, S2, S3. So of course the L2, L3, there's a branches of psoas major. So L2, L3, there's a lateral femoral cutaneous nerve. L2, L3, L4, there were two nerves, the obturator nerve and the femoral nerve. So L4, L5, S1, S2, S3 will form sciatic nerve. For the sciatic nerve, there were two, will divide it into two, the tibial portion and the common peroneal portion. For the tibial portion, we'll go to the tibial nerve, and the tibial nerve will branch out to form medial plantar nerve and lateral plantar nerve, whereas the common peroneal nerve or the common peroneal portion will be further divided to superficial peroneal and deep peroneal. Okay, so for L4, L5, S1 will form the nerve 2 quadratus femoris and superior gluteal nerve. L5, S1, S2 will form nerve 2 obturator internus and inferior gluteal nerve. So just the S1, S2 will form branches of piriformis. Okay, so that is the lumbosacral plexus.